All right, let's jump right in. Today, we're basically medical detectives. We've got a case file, and at the center of it all is one strange clue, a red blood cell that's way too big. We're going to follow the evidence and solve the case of what's called macrocytic anemia. You know, so many complex investigations start with just one tiny piece of evidence. In our case, this huge diagnostic puzzle, it all kicks off with a single number from a totally standard blood test. A number that tells us something's up. And here it is. This is our first major clue, a value over 100 femtoliters. Now, a femtoliter, or FL, is an insanely small unit of volume. But this number, it's what we call the mean corpuscular volume, or MCV. Basically, it's the average size of your red blood cells. And a normal one, it's smaller than this. So it's official. Our cell is oversized. And that leads us straight to the name of our mystery, macrocytic anemia. Macro just means large, and cytic means cell. It's a condition where the body isn't just making these giant red blood cells, but it's also not making enough of them, and that leads to anemia. Okay, so what is this clue really telling us? Well, a big red cell points a big red finger directly at the factory where these cells get made, the bone marrow. Something on the production line is going wrong. To figure out what's going wrong, we have to ask one single pivotal question. And I mean pivotal. The answer splits our entire investigation into two completely different paths. The question is the machinery that builds the cell's DNA, is it working like it's supposed to? So, this is it, the first major fork in the road of our investigation. The answer to that DNA question is going to send us down one of two very different rabbit holes, each with its own list of suspects. And here are our two paths. On one side, we have cases where making DNA is the problem. That's called megaloblastic anemia. On the other side, DNA synthesis is humming along just fine, and that leads us to what's called nonmegaloblastic anemia. For our journey today, we're going to follow the first path, the one where DNA is the problem, because it's often the more complex one. All right, so let's head down that first path. We are now officially investigating megaloblastic anemia. This is the scenario where the cell's fundamental blueprint, its DNA, isn't being copied correctly. And that, as you can imagine, causes a lot of chaos back at the factory. So here's the key idea. When DNA synthesis gets messed up, the cell's nucleus, the part that holds all the DNA, it just can't mature right. But the rest of the cell, the cytoplasm, it doesn't know to stop. It just keeps on growing. And it's this mismatch, this immature nucleus inside a giant cell body that creates the huge, dysfunctional red blood cell that started this whole thing. Okay, now we're getting somewhere. This is our list of main suspects. The two most common culprits, a lack of either vitamin B12 or folate. Some medications can do it too. And when we investigate the scene, we find other clues, like hypersegmented neutrophils, which are just really funky-looking white blood cells, and something called glossitis, which is just a swollen, inflamed tongue. So, with B12 and folate as our prime suspects, our job as detectives is to figure out which one is the real culprit. We've got to differentiate them. So let's put them head-to-head and see what the evidence tells us. Think of this chart as our forensics lab. You'll notice both deficiencies can be caused by problems absorbing nutrients, and both lead to high levels of something called homocysteine. So that doesn't really help us tell them apart. But here it is, the clincher. Look at methylmalonic acid. It is only high in a vitamin B12 deficiency. That is our smoking gun. That is the one piece of evidence that lets us nail our suspect. And believe me, telling them apart is absolutely critical, because a B12 deficiency isn't just a blood problem, it's a direct attack on the nervous system. See, B12 is essential for maintaining the protective coating around our nerves, the myelin sheath. Without it, you can get some really devastating neurological symptoms, problems with balance, sensation, even a form of dementia that thankfully can be reversed. And this right here, this shows you exactly why our detective work is so important. It's a huge warning. If you misdiagnose a B12 deficiency as a folate problem and you just give the patient folate, sure, you might fix the anemia you see on the blood test. But you're just masking the real problem. And all the while, that serious neurologic damage is getting worse and worse. Now that we've investigated our main suspects, any good detective knows you have to consider the less obvious possibilities. So let's take a quick look at a few rarer causes of macrocytic anemia that can have a huge impact if they're missed. Here is a fascinating one, Orotic Aciduria. It's a rare genetic disorder you see in kids. There's a problem with an enzyme needed to make pyrimidines, which are essential building blocks for DNA. The big clue here is that the anemia it causes will not get better with B12 or folate. That's a huge tip-off that something else is going on. And the treatment for this is just so elegant. Since the body can't make this key ingredient called UMP because of the broken enzyme, you just give the patient a substance called uridine. It basically bypasses the broken step in the production line and lets DNA synthesis get back on track. It's such a simple, brilliant solution for a really complex genetic problem. And we can't wrap this up without remembering that other path we didn't take, non-megaloblastic anemia. That's where DNA synthesis is fine, so we have to look for other culprits, like liver disease or alcohol overuse. And then there are super rare cases you see from birth, like Diamond-Blackfan Anemia, where the bone marrow factory itself just fails to make red blood cells from the very beginning. So let's bring this all home. The whole point of this investigation, the most crucial takeaway, is that our one initial clue, that single large red blood cell, can lead us down wildly different paths to totally different diagnoses, from a simple vitamin issue to a rare genetic disorder. And this is exactly why this whole journey matters. Getting the diagnosis right isn't just an academic exercise, it's everything. It's the only way to pick the right treatment, which could be as simple as a B12 shot or as specific as that uridine bypass we talked about. Getting the right answer can prevent irreversible damage. It really makes you think, doesn't it? This whole complex case, with all its twists and turns, all started from one number, from a routine test. And it just leaves you wondering, how many other medical mysteries are out there, just waiting to be solved, starting from one simple clue?